Medicaid expansion once again stalled at the State House. Supporters rallied to spark action, but not everyone is on board. 13's Callie Holthouse is live outside the State House to update the debate. Callie?
Yeah, Melissa, Governor Kelly has proposed Medicaid expansion every year since taking office, and every year it's been shot down. But today, during her Medicaid expansion rally today, now in her second term with no plans for re-election, Governor Kelly said that expanding Medicaid is at the top of her priority list for this legislative session.
We can get this done. Let's go.
Governor Laura Kelly fired up the crowd to continue pushing for legislative action during a Medicaid expansion rally at the Capitol Wednesday afternoon.
To ensure that all the people in the communities those health centers serve can continue to access basic health care.
Governor Kelly introduced the Cutting Health Care Costs for All Kansans Act last December. But GOP leadership in the legislature isn't sold.
It's not saving rural hospitals, it's not reducing emergency room usage, and really the most troubling thing is it is displacing currently eligible people.
Rural hospital closures are a major talking point.
8 rural hospitals have closed. Of those that remain, 58% are at risk of closing.
Masterson says expanded Medicaid does more harm than good for rural hospitals and strains providers.
Expansion states are not saving rural hospitals, but there's actually a slightly higher closure rate there from the last study I saw. It's a simple factor of math, right? When you take a fixed universe of providers that will accept Medicaid and you dump tens of thousands of new people in, it just by nature will displace those that are already there.
Governor Kelly contends the opposite.
This bill would strengthen our rural hospitals and health centers by injecting millions of much-needed dollars into our health system.
A recent study by the Sunflower Foundation says a majority of Kansans support Medicaid expansion.
The vast majority of Kansas voters, nearly 70%, are in favor of Medicaid expansion.
Masterson doubts the study's findings and instead says a solution to health care woes lies elsewhere.
And we just did, matter of fact, just this morning in our Senate Ways and Means, we put like $60 million more in for the reimbursement rates for hospitals and doctors, because that's where where it matters, particularly in our rural areas.
The House Committee on Health and Human Services has agreed to a hearing, though no date is set yet. Today, Kelly urged her supporters to continue pressing lawmakers in both the House and the Senate to set that date so they can get the ball rolling. We will continue covering this and bringing you the latest updates, but for now, back to you in the studio, Melissa.
We'll continue.